Cervical cancer, ranked as the fourth deadliest cancer among women, has garnered significant public concern, but is also the only cancer with a clear cause that can be detected early, prevented, and controlled. In an effort to reduce the global incidence of cervical cancer, the WHO launched the global strategy to accelerate the elimination of cervical cancer on 17 November 2020. This marked the first time that 194 countries committed to eliminating a cancer. The primary cause of cervical cancer is a persistent infection with high-risk HPV. In 2021, the WHO cervical cancer screening guidelines recommend HPV DNA testing as a primary screening method. Numerous studies have confirmed that HPV viral load positively correlates with cervical lesions. In 2019, a FDA official document recognized viral load as a major factor associated with cervical precancerous lesions. By 2022, the European guideline emphasized the necessity to adjust HPV quantification based on the number of cells per sample. BioPerfectus perfectly aligns with the clinical demands, providing the HPV DNA detection system with a globally exclusive HPV-21 type specific viral loads detection system. BioPerfectus has made an important breakthrough, measuring the number of cells in a sample by detecting the single copy gene present, TOP3 gene. Based on the multiple fluorescence PCR technology platform, standardized quantification measures the number of shed cells through single copy genes, achieving technical normalization of sampled cells, eliminating sampling differences in quantitative results. The number of HPV viral load per 10,000 cells is reported on the basis of achieving normalized quantification. BioPerfectus HPV DNA detection system provides a trustworthy screening tool. It could help doctors and patients gain a clearer understanding of infections and guide subsequent interventions. A large-scale study involving 120,000 individuals showed a positive correlation between the viral load of HPV 16, 31, 33, 52, 58, and the severity of cervical lesions. When the viral load of these 5 types is high, greater than or equal 10,000 copies per 10,000 cells, there is an increased risk of progression to high-grade lesions. In such cases, referral to colposcopy is recommended. When the viral load is low, cytological triage or follow-up after 1 year may be used. Taking HPV genotyping and quantification as a reference indices for triage management can effectively achieve accurate risk stratification for cervical lesions. This approach can help detect high-grade lesions, facilitate timely intervention, and prevent the occurrence of cervical cancer. In addition, the HPV viral load can be used to observe the effectiveness of treatment as a clinical site. BioPerfectus HPV DNA detection system provides a trustworthy screening tool. It has been used to screen over 10 million women across more than 60 countries and regions, aiding in the global effort to eliminate cervical cancer.